Hello, my name is Dr. Thomas Knackstedt, and I'm a board-certified dermatologist and board-certified fellowship-trained Mohs surgeon at Apex Skin Center. In this video, I want to talk a little bit about sunscreen. So many questions about how sunscreen works, what kind you should be using, do you really need to reapply it, and I thought it would be easiest to walk through all of this in a short video. To understand sunscreen, you have to first understand how the sun affects the skin. In addition to the visible light, ultraviolet rays coming from the sun touch our skin. These rays include ultraviolet A, UVA, and ultraviolet B, UVB. They have slightly different wavelengths, and you can think of UVA as being predominantly responsible for skin aging, and UVB being predominantly responsible for skin burning. Together, UVA and UVB cause skin cancer development. Now, when you look at a bottle of sunscreen, there's a number of different things that you'll be able to see. Some of them are regulated statements that the FDA has forced manufacturers to put on them, whereas others are not regulated and are therefore harder to interpret. The most obvious thing to look at is the SPF rating. And SPF stands for sun protection factor. And it really refers to how much of the ultraviolet B light you're protected from. So SPF only refers to ultraviolet B. Now, if you take an SPF 15 product, it filters out or reflects or protects your skin from about 93% of all UVB. SPF 30 gets you to about 97% of all UVB light. There is no sunscreen rating out there that's 100% effective. Small tangent, that's why having things like sun protective clothing can be really nice to help protect your skin. Now, sunscreen can come in two different types. Sunscreens can be physical blockers, or they can be chemical sunscreens. Physical blockers will generally have ingredients of zinc oxide or titanium dioxide. If you look at the back of your sunscreen product, those should be listed under the active ingredients. Physical sunscreens are also called mineral sunscreens. If your product doesn't have zinc oxide or titanium dioxide in it, then you have a chemical sunscreen. There's a number of terms that you'll see on sunscreen bottles that aren't necessarily regulated. For one, there's no such thing as a waterproof sunscreen. Any sunscreen is going to get washed off with prolonged submersion in water. The FDA does allow sunscreens to be reported as water resistant, followed by a certain amount of time. And if you're outdoors a lot, that can be helpful. Labels like sport sunscreen, baby sunscreen are not defined. Oftentimes you'll find that baby sunscreens contain ingredients that are well suited for individuals with sensitive skin and therefore have largely physical blockers like zinc oxide or titanium dioxide. Those products tend to be best for people with sensitive skin. Regardless of the type of sunscreen you use, it's important to reapply it regularly. I've learned that a lot of patients are great about applying sunscreen if they anticipate being outside and active. But reapplying it, especially in the midst of a round of golf or playing in the pool, can be harder to remember. So generally it's recommended that you reapply sunscreen every 2 hours or after things like a shower or drying off with a towel. Hopefully this has helped give you a little bit more information about what it is you're seeing on your sunscreen bottle.